Welcome back to Esthetics Magazine. Find more skincare resources at estheticsmagazine.com. In today's episode, we will be discussing anatomy and the skeletal system. The skeletal system consists of 206 bones in the body and is divided into two categories: the axial skeleton, which includes the skull, spinal column, ribs, and breastbone, and the appendicular skeleton, which includes the shoulders, arms, hips, and legs. The first type of bone is known as long bones, which are longer than they are wide and are primarily found in the appendicular skeleton. Both the upper and lower limbs are long bones, which provide support and enable broader ranges of movement than other bone types. The second type of bone is called flat bones, which are strong and durable, provide protection to the organs, and are primarily found in the axial skeleton. For example, the ribs are flat bones that protect the lungs and heart, and the skull is composed of several flat bones that protect the brain. The next type of bones are short bones, which are about as long as they are wide and provide stability and support as well as some limited movement. Short bones are commonly found in the wrists and ankles and are important for weight-bearing and shock absorption. The final category of bones, irregular bones, includes bones with complex shapes that do not fit into any of the other bone type categories. For instance, the bones in the spinal column and the hip bones are considered irregular bones. Over time, both peak bone mass and bone density are achieved nearing the end of puberty, after which bone mass will remain constant for a somewhat variable period until early or mid-adulthood, at which point bone mass may begin to decrease slowly as a result of degeneration. This is where primary bone conditions arise, such as osteoporosis, which is characterized by low bone mass and density and an increased risk of fractured bones of the body. The human body is composed of 206 bones that make up the internal framework known as the skeletal system. The skeletal system is the foundation of the body, gives structure to the body, and provides protection to the internal organs. Many of the bones of the skeleton are classified either by their shape or by anatomical region. The skull, or cranium, and facial bones are some of the most important bones as they protect the brain, eyes, and mouth, as well as provide the structure for the face. The auditory ossicles are the three smallest bones in the body, and they are located in the medial ear. Another interesting fact is that most adults have 26 bones in the spine, but 33 bones in children. This is because as a person grows, some of the bones in the back actually fuse together to form one bone. The thorax, or rib cage, is mainly known for its function in providing support and protection for the heart and lungs, but it's also the home to 12 sets of ribs and the sternum, or breastbone. The upper and lower extremities of the body include the shoulder girdle, arms, hands, pelvic girdle, legs, and feet. The shoulder consists of two bones called the clavicle and scapula. The humerus, radius, and ulna make up the arms, and the hands include many sets of small bones including carpals, metacarpals, and phalanges. The pelvic girdle is made up of two hip bones, the ilium and the ischium. Most people know that the legs consist of the longest and strongest bones in the body, the femur. But the legs also include the lower leg bones, the tibia and fibula, as well as the patella, or kneecap. The final part of the skeletal system, the feet, include the tarsals, metatarsals, and phalanges. All of the bones work together to support the body and give it shape. There are also two main types of bone tissue: compact and spongy. Compact bone is the hard material that makes up the structure of the long bones and the outside of the flat bones. Spongy bone is located in the ends and inner portions of the long bones and is red in color due to the blood vessels that are present. The differences in the bone tissues create both strong and flexible bones. Bone functions. Bones have several functions, such as providing structural support for the body and internal organs, serving as a reservoir of minerals for the body, anchoring skeletal muscles for movement, and protecting delicate structures and tissues in the body. The bones also play a crucial role in movement and locomotion. Without bones, movement would be impossible, and so the interaction of bones, muscles, and joints enables the body to perform a variety of different complex movements and activities. Movement is caused when a muscle contracts or relaxes. The effect is to pull or move the bone at the joint in the direction and place that the muscles allow. Through all these movements, our bones enable us to do some extraordinary things. Apart from that, red and white blood cells are formed from the bone marrow found in the hollow spaces of many bones. The marrow within the large bones of the skeleton produces the old blood cells from the body, a process that takes place within the spongy tissue of the bone. Red blood cells carry oxygen to working muscles and other tissues in the body. Every second, the bone marrow produces about 2 million red blood cells, which is a useful tip for bone health since it shows why iron, a mineral needed to make red blood cells, is so important. The marrow of the bone stores some red blood cells, but the majority will be found in the circulatory system. White blood cell formation occurs where it is needed. This could be a response to infection, disease, or stress. White blood cells, or leukocytes, are part of the body's immune system and help to fight off infections and diseases. Every day, the bone marrow produces between 480,000 and 5,000 white blood cells per microliter of blood. On the other hand, some of the long bones in our body, such as the femur, store fat in their yellow marrow. This fat can be used to make new structures in the body or to provide energy during starvation and in prolonged illnesses. The yellow matter can then be switched back to red bone marrow in certain circumstances, for example, after severe blood loss, and the body needs to make more blood cells. However, as the body ages, the red bone marrow in many bones is replaced by yellow bone marrow. The change from mainly red marrow in an infant to mainly yellow marrow in an adult is a visible sign of growth and development. It's time to level up your skincare product expertise. Are you confident explaining vitamins A, C, and E to your clients? Stop guessing! Get the Essential Guide by Greg Risha, Understanding Vitamins in Skincare. Get your copy today at estheticsmagazine.com.